presentation is a discussion on early spaying and neutering of pets.
Surgical desexing was the starting place for a means to reach what is known as a gonadectomy. According to Neuter and Kaiberlein, 2019, a gonadectomy is the process of surgically removing the testes of a male or the ovaries of a female. The first evidence of performing desexing is seen in 1893 when an anonymous veterinary surgeon wrote about neutering a male cat in the literature known as The Diseases of Dogs and Cats. In 1969, the low-cost spay-neuter clinic was opened in Los Angeles. This was the beginning of increased awareness for the benefits that could come from surgical desexing. In 1972, the ASPCA started requiring desexing of all adopted animals. Desexing one's animals has several benefits, including population control, preventative health care, along with being a good method for behavioral modification or behavioral control. There has been a great debate for centuries as to when the proper time is to spay and neuter one's pets. In 1987, Dr. Leo Lieberman sparked the prepubertal controversy with his work that was posted in A Case for Neutering Pups and Kittens at 2 months of age. He has now been referred to as the father of prepubertal neutering, as he was the only one that truly brought forward the idea of early surgical desexing. The question that is being presented today is if it is ethical to perform early age gonadectomy.
Stakeholders recognized for early spaying and neutering are animals, veterinarians, owners, and rescue shelters. Animals are stakeholders because it's their well-being that is at risk. Veterinarians have the option of whether or not to perform the procedure if it benefits the well-being of the animal. Owners must suffer consequences of their pets either going through with prepubescent desexing or not. Rescues have to consider their practices. Shelters must perform these surgeries before animals can be adopted. Younger animals adopt out easier, so it'd be a challenge to have animals past their desired age.
For those who against early spay and neuter, compare 7% of intact dogs that diagnose joint disorders, the neutering dog will have significantly higher 21% of chance to diagnose joint disorder. For female dogs spayed before age 1, female have 16% chance to have disorders, while intact female only have 5%. For the uterine incontinence for female, showing that spay female have higher possibility of 3% compared with intact dog, which is 2.5%. And also the obesity is a common concern of neutering animal, which is true compared with intact dog, that dog neutering when they were 1 year old or younger face a higher risk of overweight or obesity. And another concern is it will cause immune function problems, which is showing on the slide. And those kind of problems will cause a bad effect to animal welfare.
Organizations find benefits in early age altering, humane societies being one. Shelters take in 6 to 8 million animals annually. A shelter's goal is to prevent overpopulation of animals, and the only permanent solution to this is to alter all of the animals that enter the shelter. This often includes young puppies and kittens. Humane societies have tried alternatives, such as adopting out with altering contracts, which state that the owner must get the new animal altered within a certain time frame. However, it is seen that 60% of adopting owners do not abide by this contract. Young animals are in high demand at shelters, with 8 to 12 weeks being the desired age for adoption. Veterinarian Dr. Jeff Young states that there isn't much evidence that prepubertal altering will be detrimental. He also states that early altering has all the same benefits as if it were done later in life, such as reducing roaming, intramale aggression, and urinary marking, as well as extending the animals' lives. While there has been some evidence that early altering leads to slower growth plate closure due to the lack of hormones, Dr. Young reassures that there is no scientific data indicating this represents a long-term problem. Additionally, prepubertal dogs do not develop ovarian or uterine tumors, as well as testicular cancer. A study conducted with 32 mixed-breed dogs over a 15-month period showed that the final radial ulnar length was greater in puppies altered at 7 weeks compared to those intact or altered later. Also, rate of growth, food intake, weight gain, and back fat depth was no different in the group altered at 7 weeks compared to the other group. This study concluded that with respect to skeletal, physical, and behavioral development, the effect of altering pups at 7 weeks was similar to that of neutering pups later. Studies reinforce early altering, such as LA, who in 2008 deemed all cats and dogs were to be altered by 4 months of age, with few exceptions.
So in conclusion, there are many factors that affect the decision to perform prepubertal alteration. While the main goal of spaying and neutering is to prevent overpopulation and control behavioral or medical issues, there may also be the possible side effects of the increased risk of other medical issues, such as cancer or joint disorders. In certain cases, the benefits may outweigh the possible side effects. Since there is no correct decision to spay or neuter, it is important to weigh out the advantages and disadvantages before making a decision. Another key factor to consider when making this decision is the age of the animal. But again, if prepubertal alterations are performed too early, it can raise the question of whether or not this is ethical. Ultimately, breeders and/or owners have the freedom to make these decisions for their animals. But for rescues and shelters, they do not have these freedoms because there are policies in place to prevent certain illnesses, overpopulation, and unwanted litters.
Here is a list of our literature cited in JAS format. Thanks for listening.